currently we have a client who is a male, approximately 80-ish years of age. The client is at the end stage of his disease process and is actively dying. The client has had 3 recent admissions to hospital for an aspiration situation, aspiration pneumonia. The hospital now is saying that the client is for no further active treatment and for comfort measures to be managed within the facility. The complexity of this is that the family have expressed their wishes for their father to have active CPR, continue with his enteral feeding, continue with IV antibiotics. However, the hospital have overridden their decisions and have stated that they will not be performing CPR. The family statements are, we need to be able to go home at night and rest my head on the pillow knowing that we have done absolutely everything possible for my father. Palliative care, without getting too emotional, is something I'm extremely passionate about. I really want to be able to strive as a registered nurse to be able to deliver a really good outcome for the client and their families and their extended families, and also to be able to support the team that are actually caring for those clients.
We can see how passionate Cheryl is about delivering quality palliative care, as we all are. Cheryl's experience shows just how complex palliative care and planning for end of life is. Today we'll discuss a program designed to help aged care staff at all levels navigate those difficulties and deliver the best palliative care possible in accordance with what the person would want. The program is called Decision Assist, and to talk us through it, I'm joined in the studio by Associate Professor Deborah Parker. Deborah is an academic and aged care nurse who specialises in research in palliative care for older people. She developed a PA toolkit and is the National Evaluator for Decision Assist. I'm also joined by Sarah Margery, a palliative care and advanced care planning trainer for Decision Assist. Hello Deb, and hello Sarah, and welcome to the program.
Hi Karen.
Hi Karen.
Now Cheryl has given us just one example of challenges of contemporary palliative care. What are some of the others, Deb?
Well, that's true, and that was certainly a challenging situation that Cheryl explained. Look, people are living longer. People want to live in the community longer, and that's certainly supported by the government initiatives. But that means that sometimes people have more chronic and complex problems that need to be addressed. For people moving into residential aged care, that may be happening quite late these days. And again, it's really important for staff to be aware of how to manage advanced care planning and palliative care in that setting as well. Sometimes it's hard to get hold of a GP, particularly if you're in a rural and remote area. And even if you do get hold of a GP, not everybody's skilled with how to do advanced care planning and palliative care.
That's for sure. And Sarah, could you add to that?
Yeah, I think with what Deb's just said there, about people having more comorbidities and illnesses and living longer, it's really to our advantage in that we can plan and prepare for the best, delivery of care for those people at an earlier stage. Another complexity of our population is that we come from lots of different areas and we're of multi-ethnic origins. We have Indigenous Australians and many Australians from other countries living here too. So really giving individualised care to those people and make it the best that it can be for them.
Sure, and I guess, Deb, it was these challenges that led the development of Decision Assist.
That's right, Karen. It was a recognition by the government of the importance of this area for aged care. And so the Decision Assist consortium was put together. It has representatives from both palliative care and aged care peak bodies, from very skilled clinicians as well as academics.
Fantastic, and 2 other key people in developing the program are Professor Liz Raymond and Associate Professor Bill Sylvester. Now Liz is the Decision Assist Consortium representative for the Australian and New Zealand Society for Palliative Medicine, a specialty society of medical practitioners who provide care for people with a life-threatening illness. And Bill, of course, he's the Decision Assist Chair. He is the Director of the Respecting Patient Choices program, which provides research, education and support to health services to implement advanced care planning. So now let's go and hear from them.
Palliative care is important because we're all going to die, and so we need to do that well in a compassionate society. But also what we know is that in today's healthcare environment, most deaths are expected, and most people say they want to die at home. In order to give real patient-centred care, we need to be able to deliver that care in their environment of choice, whether that's in a private home or a residential aged care facility.
Advanced care planning gives any elderly person the opportunity to think about, talk to their family and document their wishes about the care they'd want if they became very unwell and could no longer tell us what they'd want. Advanced care planning is important for elderly people living in a nursing home or in their own home who want to make sure they get cared for the way they'd like to be cared for at the end of life. It's also important to family members to know what's happening, and it's also really appreciated by aged care staff because then they're very clear about what a person's wishes are and how to care for them at the end of life.
Well, both of them give us some key messages, but Sarah, can you give us an overview of Decision Assist?
Yeah, sure, Karen. It involves education for GPs and residential aged care staff as well as community staff. We have a telephone advisory service which offers advanced care planning and specialist palliative care advice. And we also have a comprehensive website that people can access.
That's fantastic. So Deb, who can use the Decision Assist program?
Any staff working in aged care, that includes allied health staff, general practitioners. But I think it's important to remember that the advice line is for health professionals and it's not for families and clients. That's probably a key difference.
And that's a key point. And Sarah, you mentioned education. Can you tell us about the workshops you talked about?
Yeah, sure. They come as a package, so we're aiming them at residential aged care staff and community staff, as I said, and they're free to come along to. We run them in metro and regional areas as well, and they're really, as I said, they're a package. So the aim of them is to, we give online material and online modules for the participants to complete before they come to the workshops. And then there's 2 workshops that we run around about 6 weeks apart. We do that because they're very interactive, and the focus is really to engage people and get them to take something home to really try and implement some new strategies in the workplace around palliative care and advanced care planning. After the 6 weeks, they come back to the second workshop where we can continue to work on and reflect on what they've done while they've been away, and we use that sort of team environment to take forward some new ideas as well.
Well, thanks for that. And right now we have our first caller on the line. It's Carolyn Washington from Peter Cosgrove House in New South Wales. Hello, Carolyn.
Oh, hi, Karen.
Have you a question or a comment for us today?
Look, I'd like to make a comment, if I may. What I wanted to say was that I actually did the Decision Assist workshops earlier this year, and I really wanted to say that I found them enormously informative, plus comprehensive and very hands-on. It was really a great combination of learning experiences for me. So, for example, the first workshop gave us some background information on advanced care planning and communication skills, so that it'd help us to be able to facilitate and carry out a palliative care case conference. And then during the 6 weeks between the first and second workshops, we were actually asked to carry out 2 advanced care plans and facilitate a palliative care case conference in our workplace.
That sounds fantastic. It sounds wonderful, Carolyn.
It was a great experience. And then during the second workshop, as a group, we all came together and we discussed these experiences that we'd had of doing the advanced care plans and the case conference, and talked about what went well and what didn't go so well. And it was wonderful to have those conversations in an environment where we had peer support and the support of the Decision Assist facilitators. Because we all found having those discussions quite challenging, actually. So it was a very wonderful experience. So many thanks to Decision Assist, a great experience.
And thank you too, Carolyn, for sharing that wonderful advice, because I'm sure people listening, watching the program, is certainly encouraged by what you've had to say today. So thank you.
Thank you very much. Thanks, Karen.
Thank you. And of course, the phones are open. So Kathy from Perkins Aged Care Facility in Northern Territory has rung through. Hi, Kathy.
Hello.
So, Kathy, have you a question or comment for us today?
I have a question, actually.
Go ahead.
I just want to know the process of accessing these workshops. I've been listening and it's quite interesting. And so I just, as manager here, just wanted to know what's the best way to access the workshops and find out how we can get this training when we live in a remote area.
Fantastic question. Thanks for phoning in, Kathy. Sarah, would you like to answer that?
Yeah, absolutely. Kathy, you can have a look on the website and all the workshops are listed on there under each state. We try our best to deliver workshops, as I said earlier, metro and regionally. But if there's a workshop there, or if you're in an area that the workshops don't really suit you to get to, you're advised to phone the national training coordinators and have a chat with them about what we might be able to offer for you and potentially a group of people in your area.
So if we can't get there, then we contact yourselves and we work something out.
Yeah, we'll do our best to work out something that would suit you.
Okay. And what level of staff would I send to a workshop like that, or if we organise something, who could I send?
Yep, definitely. The workshop's aimed at RNs and ENs, but we understand there's senior PCAs working in some facilities. So if they're the people that are going to be really driving some of the advanced care planning and palliative care work in that facility or in that community area, then send them along too. We're quite happy to have them there too.
Excellent. Okay, thank you.
And thank you, Kathy, too. I hope we've answered your question. Thanks for calling in today.
Yes, no problem.
Bye for now.
Thank you. Bye.
So, Deb, what a great question. But look, now that I've been on the website myself, I can see that there's a plethora of resources. Can you tell us about the website?
Yeah, it's a very comprehensive website, as you say, Karen. I think one of the really fantastic parts of the website is there's a section which is called Information Now, where you can go and you can get the latest information to answer a question that you may have clinically that you need a quick answer to. But if you look across the different aspects of the website, there's things about medication management, symptom management, things for families. We have a special section for groups with special needs, so perhaps groups from Aboriginal Torres Strait Islander people, people from different cultural backgrounds, people with dementia. So yeah, great resources there, all evidence-based.
And what I loved about it when I went on there too was I saw that there was some fact sheets and some information about people with restlessness and anxiety, and there's some of the things that aren't easily managed. So I loved the resources myself. I thought it was fantastic. But look, right now we have another caller on the line. It's Kathleen Paulson from Rural Northwest Health in regional Victoria. Kathleen, have you a question or comment for us?
Hi, Karen. Yes, I've been watching the program and I have got a comment. I'd like to talk about the Decision Assist website and how great it is.
Fantastic. We'd love to hear it.
Well, I've put it all on Rural Northwest Health computers in the favourites toolbars, and it's just great.
Well, you're just a wonderful advocate. Keep telling us. What else?
Yeah, and I've looked it up for symptom control and how to talk to a family with going through family issues at end of life, and I've looked up for pain.
Fantastic. Do you use any other resources on Decision Assist?
Yes, I have, Karen. I have phoned up the advisory service and was very impressed with the advice that I got on a pain management and for a pain pathway for a resident in our aged care facility, and it was so good. I felt like I was sitting in my lounge room.
So how did you find that advice?
Terrific. It was, like I said, I was very impressed with their knowledge, the way that they put it across to me, and it was all so easy to access as we talked on the phone and looked at the website.
It sounds like they were very easy to talk to and very friendly.
They were, Karen, very easy and very friendly. Terrific service.
And what's your advice to people watching?
Never hesitate. Just pick it up and have a look at the website and pick up the phone.
Oh, thank you, Kathleen. It sounds like your experience has been very worthwhile for you.
It has, a positive one, yes.
Thanks very much for calling in.
Thank you.
Bye now. So it is very interesting, and it's great to hear that people have had positive experiences, and I guess that's what it's all about. So now let's go and take a closer look at the phone line.
Welcome to the Decision Assist Advisory telephone service. If this is a medical emergency, please hang up and dial 000. For specialist palliative care advice, please press 1. For advanced care planning advice, please press 2.
So there are two separate lines, advanced care planning or palliative care. Why is that, Deb?
That's right, Karen. Well, the advanced care planning line is really about having those discussions and filling out the legal documents for advanced care planning. The specialist palliative care line really is more about care advice and symptom management, and you're talking to a specialist palliative care nurse.
Gosh, it sounds like an amazing resource. So where can staff find the numbers, Sarah?
Karen, it's on everything, but the easiest place to find it is on the website. It's at the top right-hand corner of every page.
And right now the number's on your screen. It's 1300 668 908. But if you look past this program today, you know it's on the top of every page, as Sarah said. Sarah, is the line only for staff, or can family or relatives use it?
Yes, Karen, it is for use of staff only.
So let's hear now from Bill Sylvester about how the advanced care planning line works.
So if someone calls the advanced care planning helpline, they'll be speaking to a nurse who's an expert in advanced care planning, so they'll understand the setting or the circumstances of the person who's making the phone call. No matter where the call's coming from, our staff can answer any questions for any state and territory because they're familiar with the legislation and the differences across the different borders. So you can call the Advanced Care Planning Advice Line from anywhere in Australia from 8 a.m. to 8 p.m. and we'll be there to take your call. So the sort of calls that we've been getting are from staff asking questions about how to speak to someone from a non-English speaking background, how to deal with religious issues, how to deal with conflict within the family, or how to bring on board the doctor that's looking after the patient with regard to what the resident's wishes might be.
The client has an advanced care directive in place and has been in place for over a year now. Despite saying that they acknowledge that their father and husband is at end stage palliating, they are requesting that the current advanced care directive remain in place with full active treatment to continue. We are trying to achieve a good death for the client, and with the multiple requests to be returning to hospital, when you can clearly see that the trauma of transferring the client backwards and forwards to hospital and getting that message through to the family has been very traumatic for all of us. With this particular case, we've also experienced some very complex situation with relating to cultural and religious background within the family. There's two different religious backgrounds, and so therefore the registered nurse Kavita was concerned that how to have these conversations with this particular family. So as her manager, I encouraged her to ring the Decision Assist hotline. The hotline encouraged Kavita to arrange another case conference with the family and gave her some guidance on how to have those conversations within that case conference. They also pointed Kavita in the direction of their webpage, which has a number of resources and links to assist her for culturally specific issues. And also gave her guidance that maybe the palliative care specialist services from community would also assist with having some discussions with the family. To be able to look after a family and the client and to be able to do it well gives you the ultimate satisfaction.
Gosh, it sounds like they have really good advice on how to handle those difficult situations. Of course, my experience is that even before you get to implementing the advanced care plan, you've got to be able to document it. It can be so hard to know how to express the client's wishes and what words to use, especially since it's a legal document. So can the Decision Assist help with that, Deb?
Absolutely. That's exactly what the advanced care planning line is for.
That's really fantastic. Now let's hear from Liz Raymond about how the palliative care line works.
When people call the palliative care line, they are immediately in contact with a specialist palliative care service, and that service provides 24-hour phone assistance to anybody who calls in. Initially, people are talking to a specialist palliative care nurse with many years' experience in palliative care. If in the situation where the inquiry may be more complicated than that person is able to answer, then the inquiry goes through to the palliative care medical consultant on call, who's also available 24/7. The calls we get from aged care workers across many different issues. Probably the most common is symptom control for palliative care. These symptoms can come out of the blue and they need to be managed quickly. The helpline gives advice about medications, about non-pharmacological ways of managing symptoms, and people will also call about family stress. Carers get very stressed looking after somebody who's dying, and how do you support people through that? Another thing that they may call about, it may be a general inquiry. They may be looking for somewhere in the area to see if there are other specialist palliative care services. The helpline can help direct them to that. They have a directory of all the specialist palliative care services across Australia, so they can refer them to that or to other local services in the area.
In our case, our lady who was palliating was symptomatic of pain despite not being able to verbalise that. What we could see from her symptoms was that her pain relief wasn't enough. Decision Assist allowed for me to go through over the phone with them what the actual medications, the crisis medications and the other pain medication was, so that we could have a look, is that appropriate now that she's actually palliating? Once they gave me the information, then I could take it straight back to the doctor, speak with the doctor and say, look, this is what's going on now. We get a reference number for our client, and when we're liaising with the GP, we can actually give the GP that reference number, and the GP can ring the Decision Assist line, give the reference number, and the case is already identified with Decision Assist. The GP came on board. The GP charted regular medication, and this lady from then on, once that was implemented, was symptomatic, free of pain.
What an amazing useful resource. So the Advanced Care Planning line is open from 8 a.m. to 8 p.m. What time zone is that, Sarah?
That's everywhere in Australia, wherever you are, 8 a.m. to 8 p.m.
That's fantastic. And Deb, the palliative care line is available 24/7?
That's right. Symptoms can happen any time of the day or night, and it's important to get onto those early.
Now, I know that we've had a caller call in to say who can she send to the workshops. And we know that some people work independently in small community services as well as home care services, and as well as residential aged care services. Can care workers really call the line?
Look, care workers can call the line, and we have had calls from care workers. Predominantly it is registered nurses and GPs calling the line. I think it's important that the care workers operate within the scope of practice. They've always got to be supervised by a registered nurse. And I think it's always good for an organisation to work out who would be the most appropriate within their organisation to call the line, particularly after hours. So I think you would always get a care worker to speak to more senior staff if they're available within the organisation, but it is available for any aged care staff member.
And of course, any of the team who ring, they get that reference number.
That's right. As the nurse said before, you get a reference number for the client or the resident that you're ringing about, so you can cross-reference that between the aged care worker and the GP if you've got two different people calling the line.
That is absolutely wonderful. And Sarah, so it's great for shift workers, we heard, and of course remote workers. They may struggle to get access to GPs after services.
Yeah, that's right, Karen. We know that the resources people have across Australia vary, so it's fantastic for that reason that anyone can call at any time of the day, wherever your location.
And I think too that even for people who know what to do, sometimes they might wonder if there's something more that you can do, or perhaps there's a different way you can do things. And I think it's a great way to confirm your thoughts and talk through a plan of action. Deb, what are your experience and what do you think about that?
Oh, absolutely. I think it's always nice to be able to have that backup and support from an expert.
It's an amazing resource, and I think, how wonderful it is for you to be able to have it. But you've heard a lot of information today, so let me summarise for you. The Decision Assist program is specifically for aged care staff and can help with advanced care planning and palliative care. It can also be used by all team members. It doesn't replace existing specialist services, but it does complement them. The workshops are free and they provide training. The website links give easy access to information in one location, and the telephone assistance gives situation-specific advice when you need it. So it's been a great program, and thanks for joining us, Deb, today. What would your take-home message be?
Well, Karen, help is available 24/7.
That's fantastic advice. And Sarah?
Yeah, the same. Don't be afraid to sing out and ask for some help if you need it.
Thanks so much, Sarah and Deb, for joining us today. Well, you've heard it all. You've got a great resource there. The only way to learn more about it is to go ahead and use it. So from all of us here at ACC and me, Karen Martin, it's goodbye and take good palliative care.
For me as a manager, my plan after I have used Decision Assist is to print the pamphlets, help the registered staff gain access to the web pages, and really roll out the information of how Decision Assist can support them, particularly the weekend and the evening and the night shift when there's no other support available to them.
Decision Assist really assists in making the best decisions for our clients and helps provide the best support for family members to make sure that that experience is, even in that worst situation, the best that it can possibly be.
Without the tools, you just can't do it. You need a multitude of tools, skills, knowledge and support from all different disciplines to be able to be able to deliver excellent palliative care. You're not on your own as a registered nurse, and I think registered nurses need to remember that there is a myriad of expert advice and guidance from all different avenues that can help you.